we're ready to make a start? I hope so. Right, so this evening the presentation is going to be on carving and first aid with myself, Laura, and there's also Roger here as well, who can help with any questions and chip in where he pleases. So I think everyone's muted because everyone's used to this by now. So are we all okay to make a start? I presume so. So my slide's now not working for some reason. Why is it not working? There we go. So we're going to start off with a bit on carving. So the whole aim on carving is to get a live healthy cow and a live healthy calf. And as you can see, there's quite a scary figure of how many cows actually die during carving, 50,000, which is terrifying. So just to start, there's a bit of anatomy. So obviously the vulva is the fleshy bit on the outside. The vagina's the bit on the inside, the channel in the mid as you first go in. And then there's a cervix, which closes the uterus off. And then obviously the pelvic canal, which is where the pelvis is. So the cow changes as she's approaching to calving. So she obviously her udder becomes filled and firm. She starts to let milk down. The pelvic muscles start relaxing. The vulva swells, and she also shows some behavioural changes, including obviously removing herself from the rest of the herd, discomfort. She might become aggressive. They're all signs that she's approaching a time. So there's 3 different stages of labour. The first one's the longest, which lasts 6 to 9 hours. This is when they start showing the separation from the herd. They'll show discomfort, get up and get down a lot, straining. You'll see a bit of mucus coming out of the back end, and during this stage her cervix is dilating, so opening up to let the calf come out. The second stage is less than 2 hours. This is when the water bag comes out. She starts increasing her efforts to get the calf out, and the calf enters the world. And then there's the third stage, which can take, well, hopefully it happens within 12 hours, and that's when the afterbirth comes out. They quite often eat it, so you might not even see that. So when does it start going wrong? So dystocia, which is abnormal or difficult birth. This can cause because the fetus is too big for the dam, so it can't physically fit out. There's a reason preventing the fetus coming out. So is it mispresented? Has it got a leg back? Is the cow's actual uterus twisted or cervix not properly dilated? So the cow's got a physical barrier why the calf can't come out. Obviously, heifers are at higher risk than cows because it's the first time they're doing it. And they've quite often not got the same room. And as long as you get there in time, hopefully everything should be all right. So just a few carving essentials which you'll need at hand. This includes rectal gloves, lots of lube, carving ropes and carving aids, which I'm sure you've all seen, and quite importantly, suitable handling facilities. Reduces stress for everyone involved and safety, and obviously stress on the cow if she's well restrained. So this is a lovely carving gate, which is ideal for everybody. Keeps the cow well fastened in, and in the event of a seizure, the side comes out and provides good access to the side of the cow, and some bars in the way to prevent everyone getting kicked. So when do we start to assist with carvings? So if there is a delay in progression of either the first or the second stage of labour, so if the water bag's been out for more than 30-60 minutes and you haven't noticed anything happening, maybe pop a hand in, check everything's all right. Obviously, if the calf is not presented correctly, it'll need assistance with helping it present in the right way to get it out through the birth canal. And obviously, if you've got any concerns that the calf is too big to fit through the dam, then you need to get involved then. So just a few rules. Obviously, as we said before, good restraint of the cow. Hygiene, wash your hands, make sure they're not covered in mud. Lots of lube that'll help get the calf out. Being able to identify what's going wrong. So is the calf forwards, backwards, upside down? What legs has it got back? And obviously, do you need any further help? So assessing if the calf is presented properly, there's a few questions you need to ask yourself. How many legs are present? And if there's multiple, do they all belong to the same calf? You want to be really aware of twins and getting them all muddled up. You need to be aware of if the calf is coming forwards or backwards. So is there a head or a tail? Are the front legs or are the back legs? And also, is the calf the correct way up? It's not twisted. There's no twisted uterus involved or anything like that. And then obviously, as we said previously, is there anything wrong with the dam preventing the calf coming out? So how do we tell if the calf is coming backwards or forwards? Well, obviously, is there a nose there or is there a tail? Then are the legs you're feeling, are they front feet, are they back feet? So as you can see on the diagram, if the calf is coming out front ways and it's presented correctly, its front claws will point downwards, whereas if it's coming out backwards, its back claws should point upwards. Obviously, and which way do the joints bend as well? So the front legs, all the joints bend, well, the carpus and the knee bend in the same direction, whereas on the back legs, the stifle, hock and carpus bend in opposite directions, as highlighted on the diagrams. So then, is the calf the correct way up? So is it twisted or not? So if it's coming forwards, but the calf is upside down, then obviously the head will not be resting on top of the front 2 feet, and this can make the carvings really difficult. And the legs will be pointing upwards. So finding out which way they're bending and if there's a nose there or not will help you distinguish if it's coming forwards or backwards. In these cases, you want to make sure that there's no twist in the uterus as to why the calf is upside down, and you need to try and get that calf with the right way up, with its head resting on top of its 2 front feet. So just a few rules for correcting malpresentation. If you push that calf back out of the pelvic canal and into the uterus, you're going to give yourself more room to make any manipulation that you need to. So bring any legs forwards, try and find the head and bring that around. You want to use firm but gentle pressure, so it's going to need a bit of pressure on it, but you don't want to do any damage to the cow. And just remember, when you are repositioning legs, you need to cut that hoof to prevent any damage to the uterus when moving it around. And as we just said on the last slide, if the calf's upside down, it'll require untwisting. So here are just a few of the many ways that they can get themselves muddled up in the uterus. Obviously, in the top left, you can see that calf is coming forwards, but it's got its head between its front feet. You want to try and get that calf back a bit into the pelvic, into the uterus, and just make yourself some room and try and get that nose and that head back up. And again, most malpresentations, you want to make yourself more room, push that calf back, and then make sure 100% that the correct legs belong to the correct calf. You're not dealing with twins, and then try and get everything lined up. So as you can see, there's lots of different ways they can get mixed up in. There's a typical leg back in the middle one at the end. Again, you're going to have to go in there, feel down to the shoulder, and then do your best to try and feel to the end of the calf's foot, cut the hoof and then bring it back up in line with the other one. So big question, when to pull or not to pull. So is that calf going to fit through or not? If the calf will move and it's making its way out with just manual traction with no use of a calving aid, then it probably is going to fit through. If you feel any bone on bone, so the calf's bone is starting to rub against the dam's bone, then it's highly unlikely that that's going to fit. If you can get that head and those front legs into the pelvis and they stay there once you let them go, then it's a good chance she'll fit. If everything's just going backwards as soon as you release any tension on it, then there's going to be a shoe size. And can you get those fetlocks exteriorized? And if so, are the front legs crossing over? Because if the front legs are crossing over, that is pressure which is going on at the shoulders, indicating there's not a lot of room there for the calf to come out. And also, is a cow in a lot of pain? If she's there and she's making a lot of noise, she's bellowing away, then there's a reason why if it gets excessive. And just beware of calves getting stuck at the hips. So big breeds like Belgian Blues commonly, the front end can get fit through, but they've got massive back ends, so it's not uncommon for them to get stuck at the hips, and it can be quite an unpleasant situation to be in when you've got a live calf which can't go forwards or backwards. Next question is when to call the vet. So if you're in any doubt, I'd always say call us. If you feel like it's out of your capability, the sooner the issue gets resolved, the better chance of a good outcome is. So there's no good messing around for hours on end and then calling us, because you're unlikely to get the outcome you want. So obviously call us if you think the calf's too big, if the uterus is twisted or there's an undilated cervix. Obviously there's two barriers stopping the calf coming out. And obviously it's the uterus, if the cow's been calving so long the uterus is no longer contracting, it's not going to push that calf out. So if in any doubt, just give us a bell. So this is the stages of assisting with calving. So first of all, start with the head. Correct any malpresentation of the head. Like I said, if it's coming forward, you want it resting on top of the two front legs. Then want to get a head rope around that. I've got a diagram later on showing how that's positioned. And then you want to, as long as the two front feet are there and lined up, you want to pull that head into the pelvis canal, see if it'll fit with the two legs there or not. And then once any traction's removed, will it stay there, or is it going backwards? Obviously when the head comes through, this is the bit where if any tearage is going to come, it'll start here. Just ease it through gently when you start pulling the head out, nice and gently, and just taking the flesh around the head and letting it expand. So this is just how to put a head rope on. Obviously they can be a bit tricky to do. The idea is to get the rope over both ears and then into the mouth and tighten it up. It's easier said than done, and it just requires practice. So the next stage is legs. So place ropes on the fetlocks. Pull one leg at a time can help with a bit of room. And then if the fetlocks don't fit through the vulva, then the calf's not going to fit through. And again, this is just a few pictures on how to apply leg ropes. You want them above the fetlock and nice and secure. You just want to be careful because it is possible to break legs with leg ropes. So make sure to position correctly. Step 3 is extraction, so this is the removal of the calf. This is a point of no return, so once that head's out, the calf's coming out the back end. You want to apply that calving aid. You put it on a horizontal position to begin with, attach your leg ropes, and then take up the tension, cranking your calving aid up, and then gently lever it downwards, and then return it back to the horizontal position, crank it up a bit more to take the slack off, and then lever it back down again to help pull the calf out a bit more. You only want to use it one-handed because you don't want to apply too much pressure. It is only a calving aid. It's to assist getting the calf out. We don't want excess pressure putting on with it. It can do damage with them. Don't want to see any bent calving aids or anything like that, please. And just beware the calving, beware of your own position with the calving aid. So once you get that calving aid on the back end of a cow, it can act as a lovely weapon. And if there's one person stood either side and that cow swings around, one of you is getting taken out by it. And once the head is out, remember to remove the head rope at that point. You don't want too much force on the calf's head. So that's that step in pictures. Just a little tip which can help sometimes, especially if you do get a calf with a big back end. Rotating the calf 90 degrees can just help make a bit more room. As you can see on the pictures, you just want to get it lined up so that the widest part of the calf's pelvis is coming through the widest part of the cow's pelvis. If anything's coming out backwards, so back legs first, you're at higher risk of the calf dying. You need to get that calf delivered swiftly, because once that umbilical cord breaks, the calf is going to start attempting to breathe, and its first few mouthfuls of breath is just going to be uterine fluid, which will go straight to the lungs. So make sure you get it out quickly, and you just want to be careful of not cracking any ribs on the calf and doing any excess damage to the cow, because you've taken the widest bit through first. And then obviously there's always the option of doing a Caesar, especially if the calf's going to be too big. As I said previously, early intervention is going to give you the best outcome. So if Caesar's an option and we don't think that calf's coming out, it's best to crack on it sooner rather than later while the cow's still up and still got plenty of energy and vigour about her. As I said, those calving gaits that we saw previously were ideal for restraint. You need a nice clean environment with good lighting ideally. You require normally 2 buckets of warm water and somewhere to put the surgical kit. So this is just a few pictures of different veterinary equipment that you might see us with as we come out. So there's some Planipart there, which is just a drug that we use to relax the uterus and just give a bit more room when we're doing difficult carvings. There's Adrenacaine there, which is pain relief, local, that we use obviously when we're doing cesarean sections. Also we can use it if we feel like an epidural would be good, which would stop the cow straining and again just help us reposition any malpresented calves. There's also some wire there and pieces of embryotomy kit, because there's always the option of chopping a calf up and bringing it out in pieces if we can't, it's already dead. And then there's a gin stick there, which can be used on either twisted calves or twisted uteruses. They're not ideal. The plastic, obviously it's a plastic rod that you're inserting into the cow's uterus, and we're in a bad situation that can go through the uterus wall. So it is a bit of kit that requires some skill to use. So this is just a bit of a slide that I've added with some abnormalities on it, so a few deformities for you. We see some weird and wonderful things which can prevent them coming out the right way or cause problems with calving. As you can see, this calf here is a bulldog calf. It's got a bit of its nose cut off, so it's pushed up. Then there's a few more curly calf syndrome, hydrocephalus, when you get a fluid build up in the brain. This is a parasitic limb, so this calf in the bottom right has got two extra legs growing out of its shoulder. And then there's the lovely inside out calf, which is always a delight in the middle of the night, where it's literally formed inside out and all its organs and skin are the wrong way around. So just moving on now onto the examination of the cow post-calving. So obviously, once the cow's had one calf, you always want to check the second one, make sure there's no twins, and it is possible to get triplets as well. So it's always worth checking that there's nothing left behind, even when you've pulled a twin out. You want to make sure that there's no tears or no severe tears at any rate to the uterus wall or to the vulva. And if there's any excess bleeding, you want to make sure that cow stops straining and ensure that she can stand up and she's not had any nerve damage. If the calf is being left on the cow, make sure that she's letting milk down on all quarters and that she's got plenty of colostrum. Also, just beware of a calcium status. Older lactation dairy cows particularly might need some supplementary calcium. So here's just a few post-calving problems you can get. So the one on the far right is a vaginal rectal tear, where the calf's put its foot through the vagina on the way out and torn up through to the rectum. The middle one is obviously a hemorrhage. It'll be pouring and spurting out blood at you. So that one will probably requires clamping off, so you can give us a ring and we'll come and sort that out. And the one on the far left, that's your uterine prolapse, so otherwise known as a calf bed out. If a cow has prolapsed its uterus, you want to keep her calm and well restrained and try and keep that uterus as clean as possible. You don't want her swinging it around, causing any excess damage to it and getting it covered in muck. It is possible that it can rupture its uterine arteries when it does prolapse out, so it's not uncommon for them to die post prolapse, which is not very pleasant. But so just a few treatments to think about post-calving. So if the cow's had a bad calving and she's a bit sore, it's always worth giving her a bit of Metacam or Oxycon just to perk her up a bit. A bit of oxytocin can always help with uterine involution and just help push that placenta out. As we've already said, check there's no second calf. And obviously, if the calf's been through the wars a bit as well, it can be worth giving it a bit of pain relief as well. If the cow's done any tearage to a uterus or a vagina or vulva, then she probably would warrant antibiotics. And as we just mentioned, whether she needs a calcium bolus or not, make sure she's offered fresh water. And if she won't drink, there's always the option of pumping fluids into her. And then just watch for that afterbirth passing through. So the next bit is a bit on calf resuscitation and post-calving care. So obviously the major causes of calf death around birth are trauma and oxygen deprivation due to difficulties in calvings. So what's normal post-birth? and what's not. So the calf should spontaneously breathe, so you'll see it taking one big breath when it first comes out, and then you want it to get going and start breathing on its own without any excess stimulation and without it breathing through its mouth. You want a nice steady breath rate. You want to make sure that it's got a heartbeat, because if it's got no heartbeat when it comes out, all your efforts of resuscitation are in vain. That calf should then pretty soon after birth lift its head up, and then within 5 minutes it should be trying to sit up and get itself into sternal, and then within 20 minutes it should be trying to stand, and then normally within an hour they're standing and walking around on their own. You want to make sure that the calf is on its feet before you leave it, and that it's suckling and getting that first colostrum. So resuscitation, as we said, check for a heartbeat. No heartbeat, there's no point. Make sure those airways are clear. So as soon as the calf comes out, you want to be cleaning its nose off of any fluid and birthing fluids and everything, just so it's not breathing anything in and it's not going to suffocate from them. Then you want to get the breathing stimulated. There's a few different ways you can do that. So you can rub the chest of the calf and get it breathing that way. Pinching the base of its nose or its ears, just to get a response off it so it takes a nice big breath. You can also shock them with some cold water down the ear as well. You just want to stimulate that calf into taking a nice big gulp of air. You want to make sure that the calf's not had any damage to it, so there's no broken ribs or anything. And then, as I said, it depends on whether you're hand rearing the calf or leaving it with the cow. You want to be making sure it receives adequate colostrum, disinfecting that navel, and then just keeping an eye on it and making sure it's getting going. So a bit more on resuscitation, as we said. Normally, the uterus, as a calf comes through the vagina, it does it does clear its nose off and squeeze any vaginal fluids out of it, but make sure you clear it off manually as well. And if it has got a bit of fluid on its chest or it's had a bit of a rough birth, you can just suspend it by its back legs and just try and get that fluid to drain out a bit. You don't want to do it for a prolonged period of time, so no more than 30 or 60 seconds, because the weight of all its abdominal contents and everything will compress onto the diaphragm and just impinge breathing, so it's less than ideal to leave it hanging there. Yeah, as we said, cold water, we've already covered this. Vigorously rubbing the chest with some straw, pinching the base of the nose can all help stimulate the calf into taking a breath. You can also get some artificial resuscitation pumps as well, which I think there's a picture of on the next slide. And also placing the calf into recovery position. So that's with its back legs pointing forwards and its front legs pointing backwards, with the calf in sternal, so sat upright is the optimum way for it to get going and get breath. So that's the recovery position there. As you can see, back legs are pointing forwards, front legs are pointing back. And that is just a diagram of a calf resuscitation kit. So it basically prevents you giving the calf mouth to mouth directly. The little plastic cup, as you can see, goes over the nose, and then that white bit pumps air. So just a bit on acidosis. So acidosis is when there's a build-up of CO2 in the calf. So it's basically not being breathing and not getting oxygen in. Indications of it are vigorous movements and excess reflections in the uterus. So that's when the calf seems really lively, which can happen quite often happens, that you think the calf's really weak and ready to come out, and actually it's just in the throes of dying before you get it out. Another indication of acidosis is that the calf is still recumbent after 5 minutes after birth, that it's not breathing regularly or properly. It just looks weak. It looks no vigor about it. It's not having any effort to stand up or get going, and it's got lack of withdrawal reflexes as well. It will eventually lead to brain damage and does have a poor prognosis if it is advanced. So neonatal calf care, obviously preventing a problem occurring is always better than curing a problem. So umbilical cord care is really important, as is colostrum management and the environment the calf is born into. So the umbilical cord it's basically a bit like an open wound. So it's obviously where the calf was attached to the cow while it was in the uterus, and that snaps when the calf is being born. And the best way to treat it is to dip it with iodine, and then if the cow is nursing the calf afterwards, it might be that she's been very vigorous. She might lick some of that iodine off, so it might require doing twice. Having the calf in a clean environment is crucial. It's clean, nice bed of straw down. You've got a lower bacterial burden in that environment, so there's less for the calf to cope with. So there's less likely chance of it getting infected. So, as I said, potential problems of inadequate umbilical cord care is that the navel will get infected, as you can see in the far right image. That can get, if it's a bull calf, it can get a bit confusing as well, because obviously the penis is in the way, and the first signs is always that it's swollen, so you just want to monitor that carefully. Obviously then further issues which can occur through umbilical cord care is septicemia. So the infection gets into the bloodstream and makes its way around the calf's body and will eventually cause death. And then there is joint ill, which I'm sure most of you will probably have seen. That's hot, swollen joints on the calf. The calf will be reluctant to move and won't do as well. It won't want to get up and drink or move around. It's really important to get antibiotics into these fast, and your non-steroidals, like your Metacam or your Loxicon again. That's really important, particularly with joint ill, because it'll provide pain relief for the calf. If joint ill is severe and prolonged, it can cause permanent damage. So just a bit on colostrum management. So colostrum is the first milk that the dam produces. It's full of antibodies, which the calf absorbs through its intestines, and that establishes the calf's immune system. It's really important that the calf gets it an adequate amount within the first 6 hours of life. We normally recommend about 10% of the calf's body weight, and making sure that it is of good quality, because if that colostrum's not good quality, there's no point feeding it. You can test colostrum quality with either a refractometer, which is the image on the left, or a colostrometer, which is one on the right, which basically just measures the density of the colostrum. After the first 6 hours of life, the calf's ability to absorb the antibodies from the colostrum does start to diminish, so it's really important to get that in. And the environment, again, as I said earlier, make sure it's clean, lower bacterial burden. You don't want those baby calves who have got a very poor immune system being exposed to lots of bacteria at once, because it's never going to end well. And then making sure that they're dry and warm. So nice big straw bed down, it just means the calf has to use less energy keeping warm, and especially in winter and the weather we've just had, a wet newborn calf is really at risk of hypothermia. So hypothermia, obviously it's when the temperature drops below 37 degrees, and it's at this time of year it's quite crucial. It's exposure to the cold. It may occur due to the dam not licking the calf off, or the calf being born into an inadequate environment. So if you ever do get a calf which has got hypothermia, you want to get it dried off, remove any birthing fluids, get it in a nice big warm straw bed. Under a heat lamp, if you've got one, is always good, and then make sure that it's being fed. So as long as it can keep its head upright, you get some milk into it, whether it's bottle fed or tube fed. So that's a little bit done about calving and newborn calf management. The next bit's on down cow management. So obviously it's an emergency, it's a down cow. The longer she's down, the less likely she's going to get up, and the more likely she's going to end in the back of a knacker wagon. So there's lots of different causes why it can happen. There's metabolic causes, so she's got milk fever, or she's got staggers, or she's got ketosis or fatty liver disease. You've got toxic problems, such as mastitis and metritis, when the bacteria is just going all over her body through the bloodstream. There's trauma. So has she done something physical to herself? Has she damaged her muscles, broken a bone, damaged a nerve, like during calving or something, or done the splits? And then there's less common reasons why, which would include blood loss, especially post-calving, or in really bad situations if you're dealing with botulism or something like that. These are just a few pictures of cows in pain. So you can see that the one on the left is holding its head straight out. It's very stiff and reluctant to move. They're both quite starry-eyed. You can particularly see on the right hand side one, the cow's got sunken eyes, and she's got some froth around her mouth, indicating tooth grinding due to pain. So what to do with a down cow? You want to get her moved to an adequate environment as fast as you can. So somewhere that's clean, dry, warm, and got a good surface with plenty of grip, because the last thing you want to do is trying to get up, falling and causing more damage. If it's summer, out in the field is best. Failing that, straw yards are the next best option. If she's down for any period of time, she'll need water and food, both within reach. Ideally, you want a roughage in front of her. You don't just want her stuffing her face with proving, because that'll cause problems in itself. And if she's not getting up at all or moving herself, then she'll need turning ideally every 3 hours, just to prevent any further muscle damage. So make sure that she gets milked. This is for her comfort and also to reduce risk of mastitis. She might need shackles, especially if she is trying to get up. And as we said about being turned, giving her some physiotherapy or massaging. You don't want her lying on one side too long, because you need those muscles to get a blood supply. Otherwise, it's going to cause muscle damage and reduce her chances of getting up. You can obviously encourage her to get up, whether that be slapping her side, gently kneading her ribs, just try and get her to stand up herself. Giving anti-inflammatories is always important. If she's got any pain there, it'll help with that and make her more likely to get up. If she had any nerve damage, it'll take the inflammation away around there. And then plenty of TLC. So this is going to be key to whether crucial to whether she gets up or not. Making sure that she is on a nice bed, she has been milked, she has got food and water in front of herself. So obviously these are just a few ways that you can help her stand up. There's your hugging clamps up on the top left. Now you want to be careful with those, because as you can see in the picture, you don't want that situation where she's just hanging there by her hips. Slings and nets are always best because they just help take the cow's body weight and they cause less trauma to her. You can get some really nasty abrasions and sores from using the hip lifters up on the top left. So that's just an ideal way of getting a cow to stand up and assist in her. The bale underneath just gives her some nice body support, where she can still take weight on all fours as well. Obviously the cow's sitting position is an indicator. Obviously the cow on the left sat nice and comfy. The one on the right, you can see that a leg that's underneath her is fully extended outwards. She doesn't look comfortable. It doesn't look good. So indications that the cow's not going to get back up. If she's had a hip lock calving, so that calf has got stuck at the hips on her hips, that can lead to nerve damage, which is less likely to recover. If she won't even sit upright in herself, so she keeps lying back on the same side all the time, that's not a good indicator. You want them sat up in sternal, so like the picture in the top left, you want them sat in that position ideally. Any prolonged time on concrete's not a good sign. If she's not making any attempt on her own to get up, then she's probably not going to get back up in a big hurry. And any odd positions of limbs are poor indications as well, because likely they've done some damage for them to be at bizarre angles. So how long do you try with a down cow to get her up? There's no solid answer to this. Some cows need more time than others, and it depends what signs of improvement she's giving. The longer she's down, the less likely she is to get up, as I already said. The more TLC you can give her, the more likely she is to get up. And there's always the option of ringing tailors. So one reason why they might not get up is if they've got a fracture, so broken bone. You can sometimes see it, or hear it if you manipulate the limb, and it just feels like a crunching sound. With calves and younger animals, they normally have quite a good prognosis depending where the break is, but in adults it's pretty poor just because of the sheer size of them. They'll need pain relief in calves and a splint or a crack cast. So in summary, so down cows are an emergency. If you're unsure, ask us. Any metabolic causes that could potentially causing it to be down, such as milk fever, we can always take a blood sample from and run them. Always check the udder, make sure she's not toxic mastitis or anything like that, and lots of TLC, making sure she's got a good bed and lots of food and water. And then just briefly, I'll just run through a few first aid emergencies. So we've already mentioned prolapsed uteruses earlier in the presentation, which is one, but also milk lane vacillations, bloats, staggers, and RDAs. So milk vein lacerations, those are the big veins which you see running under dairy cows, under the belly, running towards the udder. They can lose a lot of blood very quickly, and it can look a bit like a slaughterhouse very quickly. You want to get some pressure on that, on where it's nicked it or torn it or whatever, just to try and help the blood clot, and then ring us because it's going to need stitching to prevent it bleeding out anymore. So rumen bloat, this is when the failure to burp basically, and it's a build up of gas, and you'll see that they blow up like a balloon, particularly on the left hand side. This needs treating quite quickly. It puts pressure on the diaphragm and impinges breathing. It's got various different causes as well. And then there's staggers, so that's a magnesium deficiency. It's quite common in spring grass. signs of it can be anything ranging from sudden death, so just found dead somewhere, incoordination, abnormal head carriage, teeth grinding, again just your down cow, and they will eventually seizure with it, and then that leads to death. So treatment callers, they're going to need some magnesium injecting into the vein. Magnesium IV can kill them, so you don't want to put more than 50 mils in, and it needs to go in slowly, but it's always best to get us out to do that. So RDAs, so that's your right displaced abomasum. So your abomasum is one of the cow's 4 stomachs, and this is particularly common post-calving when the cow's got more room in her abdomen all of a sudden, and the stomachs can move around a bit more. So the abomasum does normally sit near enough on the right side, and it's quite common for left displaced abomasums to happen. So that's when it just goes under the rumen onto the wrong side, which is not as much of an emergency as when it's on the right hand side, because when it's on the right hand side, what can happen is it'll twist round on itself, and this cuts blood supply off, and the abomasum becomes strangulated and will eventually rupture and cause the cow's death. So if you've got a cow that you think has an RDA, you need to get that seen to pretty quickly. You can see a bit of distension of the abdomen, which in a big dairy cow you probably won't see that well. She'll have an increased heart rate due to pain. She probably won't pass any feces because it's actually twisted on itself, preventing any movement of intestinal or stomach contents through. She probably won't want to eat. She'll be really dull and depressed, just go off the milk all of a sudden. Her eyes will probably sink in. She'll have signs of discomfort and teeth grinding. Yeah, she'll just be one unhappy cow. So yeah, that's just obviously that's an operation which resolves that issue. Right, so that's the end of my talk. The next one is on hoof care and lameness with Mike. Has anybody got any questions? Feel free to either shout them out or type them away in the bottom. Any questions, or is that it? Okay, so we've got one question in, which is how long from when a cow starts calving till the calf dies? I don't think there's any hard and fast rule on a specific time frame. Obviously, once she's started in that second stage of calving, then you want to be getting that calf out pretty swiftly. It's more trauma to the calf. Would you agree, Roger? Which would the amount of trauma that's gone through during calving, which would increase its speed to die.
Yeah, I guess you're right. Obviously, it's the stress on the calf that initiates calving. So when a calf is being born, it's already under some stress. So I guess, yeah, early intervention is the answer there, really.
Yeah.
And even if you're unsure, it's always better just to put a clean hand in and check where we're at with the cow. You know, if we can get her in some suitably restrained in a good environment and keep everything calm and quiet, you know, get your hand in and just check where you're at. You don't have to carve it straight away. But I think, yeah, as Laura says, I don't think there is a time. We can't put a time to that, but early intervention is usually the best way with these. Yeah. So don't leave too long, really. At least assess how things are going and that things are progressing.
Oh, we've got another question coming. What is the most common cause of stillbirths? I guess a trauma during calving is a really common cause of stillbirths. Failing that, it would be the reason why the calf has died in utero, which there's quite a varied number of reasons why. But I'd definitely say trauma around the time of calving and prolonged calving times are probably the most common reason for stillbirth. Another question we've just got in: how long would you suggest leaving a calf with a cow? Again, that depends on what system you're on. So obviously, if it's beefers, then it's just going to rear a run. With dairy, it obviously, if your yoni status may have an effect on this. So if it's a yoni's positive cow, she might not have any time with a calf if you snatch calving it. Other than that, if you are intending on leaving a dairy cow with a calf just to get the colostrum and then taking the cow off to milk, then a good maybe 6 hours to make sure it's got adequate colostrum. But again, you just want to be careful in terms of yoni's management with that. We've got another question here, which I might throw over to Roger, which is the best diet for cows post-calving. They're running a suckle herd on TMR pre-calving turnout after an ideal world one's happy with cow and calf.
Well, I guess if it's a suckler herd, I guess the thing there is, what's the ideal diet? It's really to maintain the cow, and obviously you've got a calf to feed there, so you want a reasonable plane of nutrition. But I guess the key is getting the cow in the right condition pre-calving, because after that, a suckler cow really should be able to produce the goods. You know, they're not under the same pressure as the dairy cows. So as long as she's being fed adequately, I don't think there should be any issues, really. You know, they've one calf to suckle. So a reasonable plane, but other than that, I don't have any comments.